name is Erica Tung, and I'm a geriatrician and primary care internist at the Mayo Clinic. My co-authors, Dr. Larissa Hill, Dr. Robert Pignolo, and I recently published Assessing and Counseling the Older Driver, a concise review for the generalist clinician in the Mayo Clinic proceedings. The number of older adult drivers is increasing rapidly. As we age, there are unique challenges that can impact driving capacity and safety. More and more older adults and their family members are turning to their healthcare teams for guidance about this important topic. This concise review provides primary care providers with a step-by-step guide to the assessment of driving capacity. Though there isn't a single one-size-fits-all test that can be performed, we provide a comprehensive, individualized approach that acknowledges patients' capacities, challenges, and goals. In this article, we recommend the assessment of 5 main domains during a structured assessment. These 5 domains are cognition, vision, mobility with physical function, identification of comorbid health conditions that can impact driving safety, such as sleep apnea or Parkinson's disease, and medications, specifically those medications that can affect the central nervous system. There isn't a specific cutoff for when we should start doing this assessment. I usually start thinking about weaving in driving assessment into my discussions with patients after age 65, but it's really variable depending on the older adult. Some of my patients are in their 90s and are safely driving, and some of my patients might be in their 60s and have medical issues that impact their ability to safely operate a car. We often work really carefully with our patients and their family members because it's really a collaborative effort, because not only are we wanting to make sure we're optimizing independence and prolonging a person's driving experience as long as possible, but we also want them to be safe and keep other people safe on the road, so we really have a duty to work with families. After the assessment of these 5 domains, the clinician can typically risk stratify their patients into one of 3 groups. High-risk drivers, or red zone drivers, these are patients who are currently unsafe to continue driving. We need to work closely and carefully with these individuals on finding immediate transportation alternatives. Oftentimes it's their children that we're involving to think creatively about transportation alternatives, sometimes using app services for driving, sometimes using ride share, sometimes using formal senior volunteer services for transportation. Moderate risk drivers in the yellow zone, these individuals have a number of signs or symptoms that may increase their risk of motor vehicle crash. These individuals might need further formal assessment with a driving rehabilitation specialist, and they might need to start thinking about driving retirement. And then we have low risk drivers. These individuals are safe to continue driving, but we may need to periodically reassess their driving fitness. We wanted to write this article for primary care providers as they are uniquely poised to counsel patients about driving safety. Primary care providers understand their patients' health conditions, capacities, challenges, and goals. It is critical that we encourage dialogue between patients, families, and primary care teams to ensure safety on the road. When it comes time for driving retirement, working together to find transportation alternatives is essential. Thank you.
We hope you found this presentation from the content of Mayo Clinic proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.